Hi everyone, thank you for attending the PA Jumpstart event today. We have 4 of our board members today. We're from the Pre-PA Club at UCLA. We're just going to quickly introduce ourselves. I'm Christy, I'm one of the co-presidents.
Hi everyone, I'm Lucia. I'm Christy's co-president.
Hi everyone, my name is Caroline and I'm the secretary of the Pre-PA Club.
Hi, I'm Anna. I'm one of the PR and fellowship coordinators.
Okay, so we have a presentation prepared today. So Lucia and I will be presenting that. So I'll share my screen right now. Okay, can everyone see that okay? Okay, perfect. Yep. Okay, so we're the Pre-PA Club at UCLA. So first we're going to kind of talk about what a PA is. So we're going to try to keep it pretty short. So the official definition by the American Academy of PAs, they define a PA as a clinician that diagnoses illnesses, develops and manages treatment plans, and they prescribe medications. PAs often serve as a patient's principal healthcare provider, and they also work with a collaborating physician. And PAs do practice in every state. And they also, you'll find PAs in numerous specialties and working in different types of medical settings, such as at the hospital or in the clinic. And one of the big goals of the PA profession is really to bridge that shortage of primary care physicians and to improve healthcare access and quality. And some other notes about the PA profession is that they're trained as a generalist during their medical education. And there is also no required residency or fellowship unless you do want to. They do have PA residencies that you can apply to after you complete PA school if you want. And in many cases, PAs do similar tasks to physicians in that specialty, but there are several differences here and there.
Okay. So how to become a PA, part 1, which I'm sure all the other schools are going to go into much more detail about this, but generally you need to complete your bachelor's degree and fulfill the program requirements. You can also do this after you complete your bachelor's, but and then you need to gain patient care experience and healthcare experience, and the hours vary for each program. PA shadowing is also very important. Some schools don't require it, but it's always recommended so that you understand the role of a PA and you've seen it firsthand. And then also letters of rec. The amount varies for each school. I think CASPA lets you enter up to 5. And then the GRE, which is only required by some programs. A lot of schools in California, though, don't require it.
Okay, and then the next step after you complete everything in the previous slide is to apply to PA school. So you apply to PA schools via the CASPA platform. It's kind of like the common app for PA schools. And each cycle begins in the April, and then you start getting interviews hopefully by around fall of that same year. And then the deadlines for the CASPA applications is usually between October and December of that same year as well. And then next, you'll fill out any supplementary, secondary applications that schools might have, and then the interviews. And then once you get accepted, hopefully you'll begin attending the PA program, which usually ranges between 2 to 3 years. It depends on the specific school. And note that there are PA and PH dual programs, so Masters of Public Health and PAs. Those programs are usually a little longer, so around 3 years. And then once you complete a PA program, you can take and pass the PANCE, which is the PA National Certifying Exam. And then after that, you get your license and you can start practicing and then applying for PA jobs.
Okay, so something that we wanted to continue this presentation with is that we were recently ranked #1 best job in the 2021 US News, which is really exciting. It's something to brag about. And the median salary, it also depends on which specialty you work in and which state, but it's around $112,000. And something like very unique to the PA profession is that you can switch specialties or work in multiple specialties at once, which is something I've seen many times. And some of the common specialties are like family medicine, surgical subspecialties, emergency medicine is very common, urgent care, dermatology, internal medicine, and orthopedics.
Okay, so what does our club do? So our main goal is really to educate any undergrad or just even many of our members have graduated from UCLA and they're just taking their gap years right now who just want to keep learning more about the PA profession. And we invite guest speakers who are current PA students, practicing PAs, and PA school program admission representatives, and also other healthcare providers to speak to our members. And we also provide some resources such as what specific classes you need to take to fulfill your prereqs, specifically at UCLA, how to navigate CASPA, finding PCE jobs, shadowing opportunities, volunteering opportunities, and sometimes we'll have some more hands-on workshops during the regular school years when we do have in-person meetings. So in the past, we've had some suture, BLS, and CPR workshops. And we also do socials so that our members can bond. And also during a regular school year, we provide transportation to attend upcoming pre-PA conferences, as well as any local PA program open houses as a whole club. And we also have a mentorship program where we do pair some more experienced pre-PA members with some people who are just starting to learn about the pre-PA path. And yes.
Okay, so something important that you guys would want to know is what you gain from being involved in our club. So information regarding the PA profession, tips on how to become a stronger applicant. You can network with other pre-PAs and kind of build a community. There's leadership opportunities like being on committee or being a board member. Raffle items are always a perk. And then also just being part of a pre-PA club shows an admission committee that you're passionate about becoming a PA and you are knowledgeable. And the most important thing is the more you put into the club, the more you gain.
Okay, so next we're going to talk about some membership requirements. So for the remainder of this academic year, membership is $10 and you'll receive a club t-shirt and sticker and you'll be entered in our quarterly raffles. And also if we ever have any upcoming volunteer opportunities or shadowing opportunities, those are usually limited in space. So you'll have priority placement with those opportunities. And our membership application link is up there on the screen, but you can also scan the barcode to the right. That'll also take you to our membership application. And typically membership requirements are 3 GMs per quarter, as well as 1 fundraiser, social, or volunteer event each quarter.
Someone had a question in the chat. If you can join the club at any time of the year, and yes, you can. You just have to fill out the membership app, which is just basically us getting to know you, and also the $10 membership fee. And feel free to reach out to us at any of our socials, DM us with any questions, and we'll be pretty responsive in getting back to you.
And that's the end of our presentation.
Thank you, everybody. Is any of you still have any questions for the Pre-PA Club? Feel free to put it in the Q&A. I don't know if Lucia, Christy, and Caroline and Anna is planning to hang out for the rest of the evening. But if you are, then you might be able to see the chat in case you get any other questions. Will that be okay with you guys?
Yeah, of course.
Okay, perfect. So I think you did get one. Do you need to be doing the pre-med program during your undergrad?
I'm not sure what you mean by pre-med program, or maybe like if you're in a pre-med major track kind of thing. You don't. You can be any part of a major, and also something unique about PA school is that you can be any major just as long as you get the membership requirements done.
Yes, and also something to add is that many PA programs, they have similar prereq courses. So that's usually anatomy, physiology, microbiome, some chem and bio classes. And those classes you don't necessarily need to take at your undergraduate university. So if you're at UCLA right now, you don't have to take it at UCLA, especially since a lot of the classes are very hard to get into here. It's really impacted. So you can actually take those courses at another community college that's accredited, and you can definitely transfer the credit over and apply to PA school using those classes.
Thank you so much again, girls. And in the interest of time, I'm going to move on to the school presentations. So the first school is Western University. So I'm inviting Jaziel. Are you there?
Yes, I'm here.
All right.
Hi there.
And you should be able to share your screen if you wish.
Okay, great. I had a student just having trouble with the link. She's not able to log on. So I just
Not even that link that I gave you?
No, she said the link wasn't working. So I will go ahead and I'm sure she'll be happy to share her email if you have any questions or any questions.
Okay, I'm gonna put another link into the chat for you. Maybe that's gonna work. Hold on one second. Should work. I'm not sure. Okay, let's try this one. All right.
Okay. Looks like I will send it to her. I'm not sure if she will.
Okay.
Get it, but I'll go ahead and get started so we don't.
Very good. So take it away.
Yeah, no worries. Can everybody see the PowerPoint?
Yes. Oh, one more thing. So you guys
Yes.
can know who is in the audience. I asked for a poll. So audience, you have 2 polling questions to help the presenters understand who you are. So feel free to fill it out. It will help a little bit. We are at 83%, 87. 4 people are holding out on us. All right, 2 more. Let's get to 100. 3, 2, 1. All right. So share results. So for those of you who are presenting, majority of the attendees are junior, and they are planning to apply to PA program, not sure. But some of them in 2022 and 2021, 17%. So.
Awesome, thank you.
There you go.
In terms of time, I'll make my presentation short, and then are we having a Q&A after, or I know that there was a professional panel, so.
We can do Q&A at the end of your presentation, and attendees, please start thinking about questions as the presentation is going, and you can plug it into the Q&A.
Awesome. Okay, so my name is Giselle. I'm University Recruiter for WesternU. I'm the liaison to the College of Health Sciences, so that encompasses the PA program. And we started off as a DO school, so College of Osteopathic Medicine. Then we started developing other health professions in 1996, and now we are one of the largest graduate institutions in California. Health professions. We have 26 programs. When I started about 8 years ago, we had 23, so we're definitely growing. This is a list of our doctorate degree programs that we offer if you're looking to further your education or your career. master's degrees that are offered, and we're going to be talking about the PA program here at WesternU. So our PA program, this is an outline of what we'll speak about. So our PA program is 2 years. We do not have an admissions entrance exam to apply. We'll talk about prerequisite requirements, where you'll be doing your clinical experience, how to be a competitive applicant, and then application dates and deadlines, which is very important, and then the cost of the program, and then who to contact when you apply. So this is an outlook on the profession. I know the ladies had shared the how it's growing. PA, the jobs are going to just continue to grow, and then the median salary. I believe this might be for California, but it will vary. So why WesternU specifically? Just the Great Southern California location. We're a small campus in Pomona, California, if you are not aware. We are health focused and we have interprofessional education within the curriculum. So you will be having a chance to work with other health professions on campus. We have early clinical training and a consistently high graduation rate and board pass rate. We have a diverse student body, and we do encourage non-traditional students. So our students can vary from different backgrounds of careers, in age, and in their demographic as well. We have outstanding student support. So we have our lead office, which houses our counseling for academics if you're struggling in the program, or if something personal has happened and you need some additional help, you'll have some resources there. And we also have a Center for Disabilities as well. Student outcomes. So when you're looking at a program, you're going to look at the outcomes. You definitely want to know that you are being prepared for this program to pass the boards and graduate on time and placement in the field. And then, as they stated earlier, some go on to do internship and residency. This is just a little quick overview of the curriculum, what your year one will look like in your year two. And the next slide, this is a little timeline. So year one, you will go through the summer. Don't worry, you'll have some breaks as well for the holidays and for spring break as well, but you will be working or in class through the summer. So class time, study time, and then clinical experience. Then that's the end of your first year. Second year will focus on clinical rotations in your master's thesis. And then you're done. So this is a list of your required rotations and then a partial listing of the elective rotations that you will be able to choose from. So the surrounding clinics and hospitals will be not very far from the campus, but we definitely will have the faculty work with you in setting up these clinical experiences. We have a patient care center on campus, which is awesome. This is open to the public. Again, we like to give back to the community. So this is open to the community of Pomona, and some of our MSPA students will provide healthcare there as well. So application requirements are really important. So these are the main requirements here. You must have a bachelor's degree. It could be in any field. GPA requirement is a minimum of a 3.0. So anything 3.0 and above will meet the requirement. 2 letters of recommendation. It can be from a PA, a supervisor, somebody you've either worked with or shadowed, or it could be a science professor. So those are a little bit of an idea of who you want to get a letter recommendation from. So, and definitely know who you're asking for the letter of recommendation, somebody that you've built a relationship with or a mentor. And then community service is a new requirement or newer requirement. So community service could be in any field. It does not need to be in only healthcare. It can be just involvement in the community, whether it's a brother-sister program, big brother, big sister program. you're working at a food bank, or you're working at a senior citizen home. So there are a few ideas on our website, and I'll share the link with you all in the chat later. Okay, so prerequisite requirements. So prerequisite requirements will vary for each PA program, so you definitely want to take a look at those specific course requirements. They may overlap with other PA programs, but ours may be different. I'm actually going to go back so you can get a better look at these prerequisite requirements. I believe this is like the most questions I get asked when we have advising appointments or visits on campus when we're back on campus in a normal setting. But we have a prerequisite database by institution that's really helpful. So if you have questions about retaking courses, or if you're not sure that the course you've already taken meets the requirement, this prerequisite database will bring up your institution and then what course we will accept. So this is pretty helpful, and I will also share that in the chat as well. That kind of eases your mind on having to send an email or get a hold of somebody if you just have one question about one of our prerequisites. And again, it'll be a listing of universities and colleges across the country. So this is the competitive applicants stat. So you want to definitely apply with a strong application. We do receive a number of applications and only a few interviews that are granted, just shy under 600, and we seat 98 in the class. So overall GPA 3.66, prerequisite GPA 3.75, and then overall average science GPA is a 3.67. So you definitely want to try to meet or exceed these averages, but that's not to say that we will not look at your application if you don't have these averages. We're just putting it so applicants will definitely know what the GPA average is, and if you would like to be competitive, again, it's a competitive application process. We have a number of applications, so you definitely want to meet or exceed that average. If you are a little bit below this, or if you have a lower GPA, we do recalculate the GPA, or the admissions actually team recalculates the GPA. So if you have retaken courses, you want to indicate that on your application so that they can recalculate your GPA, and that should boost your science or prerequisite GPA. So what makes a competitive applicant for WesternU? So GPA definitely, and then demonstration to the commitment to the community. So again, this is going to be a requirement now. So having, we're not looking for a specific amount of numbers of community service, but we're looking for somebody that has an ongoing trend of community service. So GPA, commitment to the community, and then shadowing it or interviewing a PA. You definitely want to have knowledge of the profession and then knowledge of the program as well. So I encourage you to visit our website if you're looking to apply to WesternU, and then setting up an advising appointment if you'd like. I would be happy to speak with you more on the application process, and then we'll be going over that a couple of slides in the presentation. Joining a pre-PA club and different organizations is great as well. All right, so tuition is $44,100 per year. Definitely is going to be through the financial aid office. If you meet with a counselor, they'd be happy to discuss, how to apply, when to apply for FAFSA or for additional loans or scholarships. They're available at finaid@westernu.com or westernu.edu, or by phone. I know we are all off campus right now, but I'm sure that they would be happy to speak with you over the phone. So application dates and deadlines. CASPA is going to open mid to late April, so you can start filling out your application and then submit it. They haven't given a specific date yet, so I want to say it's mid to late April. Last year was April 30th. This year it may vary. And then our application deadline is November 1. So your application needs to be complete, not verified through CASPA by November 1. So we do encourage you to apply early. We are not rolling admissions, but we do highly encourage you to just submit everything as early as possible, just due to transcripts and other, it takes processing times to receive the application or to receive transcripts through CASPA. So we do want to encourage you to apply as early as possible. And then if you have any questions, I would be happy to speak with you. Once you submit your application, we have an amazing admissions team. So Michael and Janine would be happy to go over any specific prerequisites that maybe are not on our prerequisite database page. Sometimes, there's so many courses, it may not have been updated, or maybe it's a course that the college will now accept. So don't be too discouraged if your course is not on the prerequisite database. You can feel free to email either our admissions team when you apply, or you can feel free to email me at any time.
Thank you, Jaziel.
Oh,
You
thank
have
you.
one question in the chat.
Okay.
Will online labs taken in spring 2021 count toward the prerequisites?
Yes, so we are taking it semester by semester, and we definitely want to work with the current situation of social distancing. The college is going to be accepting online labs for spring 2021 and for the entire year of 2020. So anything that was taken last year, online labs are going to be accepted.
And there is another question in the chat. What's the average number of PCE hours for people admitted?
Okay, I did not see that one. So patient care hours are actually not a requirement. That's why it wasn't included. Yeah, so we do not require those for our PA program. It may vary with other programs, but the patient care hours or patient contact hours are not going to be a requirement. You can definitely include it on your application, but it's not going to be something that the admissions committee is going to require.
Thank you again. If you have any other questions for Jaziel, please. Okay, so there is one more in the Q&A. I've heard Western weighs GPA heavily. My GPA is below the average matriculated class. Should I be focusing on raising my GPA at community colleges or focus more on gaining patient care experience? It's been difficult getting in-person shadowing opportunities because of the pandemic. Will virtual shadowing count?
Okay, yes, shadowing is not required, but if you do have that shadowing, virtual shadowing hours, you can include that in your CASPA application. And then as far as the GPA, because we don't require patient care hours or patient contact hours, I would focus on boosting your GPA with retaking anything that's below a B or a C. That's really going to bring down your GPA, your overall GPA, especially if it's a science course or a prerequisite. It will bring down your overall GPA and your prerequisite GPA.
Thank you. If you have additional questions for Jaziel, please put it in the Q&A with Western University clearly in the question, and she will be monitoring the Q&A and she can respond individually. Next up is Marshall Ketchum, Marshall B. Ketchum University. So,
hey, okay, I'm about to share.
Hi.
I'm gonna share my screen here for make sure everyone can see it first. All right, can everybody see that?
Yes, we can.
Okay, awesome. All right, let me minimize this window. Okay. All right. Hello, everybody. My name is Chinadu Amadi. I am the admissions coordinator for Marshall B. Ketchum's PA program. So I just wanted to let you all know, I'm really happy that you can make it. I think this is a really great opportunity for you to get to learn more about our program, as well as all the other great programs that are here today, including Western and Cal Baptist. So, really thank you for being here, and I hope you really are able to get something valuable out of this experience. So for my presentation, I am going to go over a little bit about who we are as a program, what our program consists of, and then a little bit about our admissions process, what you can do to try to put yourself in a position to attend MBKU and how you can go about the application process. Okay, so a little bit about our program details. So Marshall B. Ketchum University, we are located in Fullerton, California. So we're actually right across the street from Cal State Fullerton. So our university was founded in 1904 by Marshall B. Ketchum, who was an MD, but he also specialized in ophthalmology and optometry. So, we've been in existence for over 100 years, the university itself. But within the past decade, we've added our pharmacy program and we've added our PA program. So our PA program was established in 2012. Our first graduating class was 2016. So in total, we've had about 5 graduating classes, with the most recent one being 2020. So each class size is 40 students. The students, they tend to like that because it is a relatively small class size. If you calculate the numbers, it's an 8-to-1 student to faculty ratio. Students tend to like it because it is more, it's a personable atmosphere. The professors are really accessible. They're really committed and always available. It is really a smaller type of campus. Of course, like I said before, it's right across the street from Cal State Fullerton, which has over, 30,000 students, but right across the street, we only have a handful, a couple thousand, maybe a couple hundred actually, a couple hundred students. And so that small class size really does help the students feel like they can have some access to the professors. They can, if they're having some troubles with the studies, or they need to really try to grasp the information that they're being taught, it's easy for them to reach out to the professors. It's easy for them to know all of their classmates. And it's really just a great place for them to connect with everyone, because it's not very much people. So another thing, our program is a consecutive 27-month program that confers a Master's of Medical Sciences. So just for example, the current class that we have, they started, the class of 2022, they started school in August of 2020, late August. And so they'll go from August till November for their first year, which is what we call the didactic year. And then in November, they'll have maybe a 2-week break. They'll go from their 2-week break into their clinical rotations. And that will encompass the whole consecutive 27-month program that we have. And then at the end, they'll graduate and they'll get a Master's of Medical Sciences. Okay, so I would like to read off our mission statement for you. So our mission is to educate individuals to become compassionate physician assistants who can provide the highest quality healthcare in a collaborative environment, are dedicated to their communities, and advance the PA profession. So of course, our main goal is to be able to empower, to teach, to enable our students to be able to become competent physician assistants, to have the requisite knowledge and the requisite skills to be able to, go into the workforce and be someone whom their patients can really trust and rely on. But in addition to that, our program is really big on having a community service oriented mindset. So that's something that we do try to instill in the program. Of course, you see it's part of our mission statement, but it's reinforced through our through the didactic year, the first year, where the students have required community service events that they have to go to. So whether it's once or twice a month or once every other couple of months, the students are required to go to these community outreach events. And we really do like to do this because, of course, as I was saying, we do want our students to be competent and be able to really have the skills to do the job, but we also want them to be able to give back to their communities once they become licensed, once they, become, they're hired to and practice their physician assistants duties and responsibilities. So another thing that we like to mention to students is that, you want to look at our mission statement. You want to look at our mission statement and look at your your own goals and values and see, does it align, does the mission statement align with my own values and goals? And if it does, then it's, a good program for you to look into, good program for you to apply to. And it's really a good starting point to try to determine whether you would like to take this route and apply to our school. A quick thing here about accreditation. So we are accreditation continued by ARC-PA. And so really all that means is that we are following all of the regulations and the standards that ARC-PA has set forth for all programs who are trying to become a PA school. And so fully accredited, we're following all the standards, and the standards are related to, hiring, they're related to, just sort of guidelines on how to run schools, they're related to curriculum. So in terms of accreditation, fully accredited continuing is a really good thing. And that just means that we're following all the rules that are set forth by ARC-PA. Okay, so I wanted to get a little bit into the didactic phase, just to review. So it's a consecutive 27-month program. The first year is going to be the didactic phase, and the second year is going to be the clinical phase. In the didactic phase, this is where students are typically going to be in the classroom. So it is a full-time post-baccalaureate program. So they'll be in the classroom, pretty much from Monday through Friday from 8 a.m. to 5 p.m. Those aren't exact times, but approximately that's what you can kind of look forward to if you were to be a part of the cohort. And so I would say something that is really representative of our program is what is called our systems-based modular learning system. So what that means is each disparate system or area of the human body is going to be split up into modules, okay? So for example, pulmonology, the respiratory system is going to be split up into one module. And in that, it's going to be 2 to 4 weeks, and the students are going to dedicate all of their time to that one pulmonology module. They're going to learn the anatomy and physiology, they're going to learn the pharmacology, the pathophysiology, patient assessment skills, medical diagnoses, all in 2 to 4 weeks. And so that's going to be one module, and there's going to be an exam at the end of the module, which is most likely going to be on a Friday, right? And so, and then once they're done with that module, they'll move on to something like cardiology, okay? And they'll do the same thing, A and P, the pathophysiology, pharmacology, et cetera. And then they'll do the same thing and move on to something like nephrology, okay? And so that's how our systems-based modular learning system is. And one thing I can tell you is that the students do seem to like it because all the information, it is sort of packed into these 2 to 4 weeks. So that can be more conducive to retaining that information because you're learning all of this in a time period. So in terms of, I would say, in associations and how you remember things, having something that you're focused on for 2 to 4 weeks, that can be really helpful when it comes to your PANCE exam, when you're trying to pass the PANCE, and also when you're actually licensed. It's like, oh yeah, I remember this, this time of my life, something, just you remember this time of your life when you were in your cardiology module, right? Or when you were in your nephrology module, and just the systems-based modular learning system, the information builds on each other and makes it just really easy for you to build upon the information you've already learned and add it to your repository of knowledge that you continue to accrue while you're in PA school. So I would say that is really a really good thing, a really maybe unique thing for our program that students are really appreciative of, and that we really like our faculty. We really enjoy that the students are able to kind of get this information in the bunches. And another thing about our curriculum, so the exams are pass, no pass. I would say that's really helpful to kind of take out the competitiveness of PA school. And so from what I see, the students do work a lot together. In addition to being friendly, they're really willing to share notes with each other, share advice, share insights on how they see what the professor or the lecturer is explaining in the lectures. And that's, you know, having that no pass, it really just does help instill and reinforce that collaborative atmosphere that we really like to see. And that translates into when our PAs are going to become practicing PAs, you know, because when you're going to get into the workforce and maybe work, you're a PA, but you're also going to work with maybe nurse practitioners. You're going to work with MDs. Maybe you're going to work with orthopedic surgeons. Maybe you're going to work with physical therapists. And that's really common. You're just going to be working with a whole host of other health practitioners. And so what we do in the program is we try to get students ready for that and introduce them to that collaborative atmosphere. So that kind of goes over the didactic phase. So as I said before, you know, you go from August to November. So this current class is going to go from August 2020 to November 2021. And November 2021, they'll get started with their clinical phase. And so the clinical phase for our program, you're taking your the knowledge and the skills that you learned from your didactic phase, and you're going to apply it into real life situations. So with the clinical phase in our program, we have 8 required clinical rotations. And so 6 of those are going to be core rotations. Some of those include pediatrics, family medicine, general surgery, primary care, behavioral health, emergency medicine, right? And so, and then the elective rotations, you see the list there. I know some popular ones are dermatology. Another popular one would be maybe cardiology. There's a lot of, you know, you have the choice of what you want to do. You have the choice of what you want to do. And so the really good thing about these clinical rotations is that you have the opportunity to, of course, learn. You'll be working with the preceptor, whether it's an MD or surgeon. You'll be working with the preceptor, and they'll be able to kind of guide you on what they see and how they make things easier for them and how they go about approaching you know, the treatment plan for their patients. And so this will be a good time to ask questions to your preceptors, to your colleagues, ask questions. And also it'll be a good time to make a good first impression, because from what I've seen, a lot of students are able to get jobs from their clinical rotation sites because the preceptors or the people that they worked with, they have such good relationships. And they were so impressed with their dedication and how they were able to perform and how they were able to care for the patients, that it's just kind of like a seamless fit. And so that's something to keep in mind. You really do want to make a good first impression and really just work ethic, work really hard, and ask questions. You know, no question is not allowed. Just ask any question that you have, and it'd be good for you to learn and good for you to kind of build relationships.
I just want to let you know that we have a couple of maybe 1 to 2 minutes left.
Okay, that's fine. That's fine. Yeah, that's fine. Yeah, and so I'll move on to the next slide for the admissions. So just real quick, so for the requirements, these are the hard requirements on the top: bachelor's degree, 3 letters of recommendation, official transcripts. We do not require the GRE, the Casper, or shadowing. GPA is not required, but you do want to aim for 3.0s in your overall GPA science, and you do want to aim for at least 1,000 hours of direct hands-on patient care experience. And then just for the prerequisites, we have 8 of them, minimum 3 semester or 4 quarter units. You can take them from community college or 4 years. There's no preference. Extension schools even. Western just presented. We do see a lot of applicants taking courses from Western, the accelerated courses, and that's fine as well. And we do allow up to 2 in-progress prerequisite courses when you're applying. So just for example, December 31st of this year, for the 21-22 application cycle, you would have to complete them by December 31st with the transcript sent in. And I'll just go over the deadlines real quick. And so we have a priority deadline of September 1st, and then a final deadline of November 1st. Priority deadline is helpful because we do understand that there are different programs, different starting dates. So you have the opportunity to maybe get an earlier application decision or an earlier interview invite if you apply before the September 1st deadline. But that doesn't mean that if you apply before the September 1st, that your application will be reviewed, because we don't go by enrollment admission. So the final deadline is November 1st. All the applications that are submitted by then will be reviewed. And then after that, typically we have our interviews in December, and then they run through early February. There's just some helpful links that you can I can put in the chat, and you know, I'll have this be my last slide here. You know, just in review, small class size, you know, low student faculty ratios, our systems-based modular learning system, and our community service oriented mindset. Those are, I would say, that's a distinguishing, or just kind of unique to us, that kind of makes MBKU what is MBKU for our PA program. Our community service, modular-based learning system, our family feel. It's small, but everybody really connects with each other, and everybody's looking out for each other. And so if you have any questions, just feel free to ask me or email me. But for the sake of time, I'll go ahead and end it here.
Thank you so much for the presentation. I already put in the chat. If you have any questions regarding this program, please put it in the Q&A. Chinedu will be here to monitor the Q&A for a little while, so feel free to put your questions there. And we're gonna move on to Stephanie. Are you there?
Hello, yes, I'm here.
Yes. Awesome. All right, Stephanie is representing Cal Baptist and will be presenting on their program.
Perfect. Let me get my slides going here. All right, can you all see my CBU graduate school with blue background?
Yes, we do.
Thank you so much. Well, I'm Stephanie Fluid. I'm the admissions counselor for Cal Baptist program, and I don't know why that didn't advance, so let's try something else. Fascinating. It's because I'm at the end. This is a note for everyone. Make sure you're at the beginning before you start. Okay, so I want to tell you a little bit about Cal Baptist as an institution. We have 4 core values. So we want to make sure that our students, when they graduate from us in any program, they leave academically prepared. They know the theory, they have the hard knowledge, and they have those skills to be great practitioners. We are a Christian institution, and so students do not have to be Christians to attend CBU. About half aren't. But know that all the faculty and staff are Christians, and they'll teach them that worldview. So this is why we think the human being is valuable, why we want to alleviate suffering, and what motivates us to want to help people live healthier and happier, hopefully longer lives. We want to make sure our students are globally minded, and they know that while there's a great deal of need for healthcare here in Southern California, there's also a lot of spaces around the world that have even greater needs. So we want students to know that they can take those skills elsewhere and help other people beyond our borders here, eventually, once the pandemic has slowed down. Well, we also want to make sure that students have the soft skills and the interpersonal skills to be equipped to serve well. So on the one side is the head knowledge, on the right side is the reading what your patient's telling you, knowing if they're not telling you everything, being able to ask a few more questions to get the information you need, and to take that head knowledge and develop it with compassionate, service skills to those patients to help them the best. So we have a couple of features about our program that I want to point out. We are a newer program. We started in fall of 16, and we were very proud of our first class to go and win the CAPA Bowl, which is the California Academy of Physician Assistants Student Quiz Bowl at their annual conference. We followed that up in 2018. In 2019, we made it to the semifinals, and then our team just won the virtual conference this summer with their 2020 CAPA Bowl. So we're very proud of them for how hard they worked on that, especially as we're a new program. Our classes run Monday through Friday, 2 years. We have a 3-semester school year, so it does go all year round, as the other programs shared, and our students graduate on time, so it's 24 months, you're done. Here's our first group that won that CAPA Bowl the first time around. 2 of our gals, Jillian and Robin, doubled their team for 2018. And then this is our team who was doing their virtual because the conference was done that way here for 2020. So proud of all the hard work that all those students have put in. Let's talk about our requirements. So you do have to have a bachelor's degree. I feel like I'm repeating what a lot of our other reps have already mentioned here. And that has to be done by December 31st of the calendar year prior to the fall that you're applying for. So if you had applied for fall 21, you had to graduate by December 31st, 2020. That's the same for prerequisites. They could be in progress, but we don't interview anyone until the prereqs are done. So it's to your advantage to wait and apply once you have completed everything. We have an overall GPA minimum of 3.2. Science and prerequisites need to be 3.0, and those are all evaluated by CASPA. We do require 1,000 hours of patient care experience. That can be taking vital signs, medically scribing, a lot of MA, CNA, LVN, ED Tech, EMT experience. We take physical therapy aid. So those are some of the options there. We want to make sure that you're not going to faint at the sight of blood or other bodily fluids, and that you've had a chance to develop a good bedside manner with patients. We also look for 3 letters of recommendation: medical colleague, professor, supervisor. Mix it up a little bit so they're not all in the same category. Here's our list of prerequisites, and this is also available on our website. This has been set, and it's extremely similar to the others that we just saw earlier today. And so that's been pretty much the same, no changes there. They do need to have been passed with a C or better. We are talking about moving that up to a B-. And this is because of the volume of applications and the 30 seats that we have in the program. So that's not fixed yet, it's still under discussion, but know that if you have C's on a lot of prereqs, to be more competitive, you may want to repeat those just to help yourself out. We prefer that they were done in the last 5 to 7 years for the sciences, but that is not a hard rule. So if you did well the first time, I don't think there's a need for you to repeat it. And of course, we have flexed on the science online labs because of the pandemic. So as Western had shared earlier, for all of 2020 and so far the spring of 21, we will accept online labs if you took the course within that time frame. No decision has been made yet for summer or fall 21. AP tests can be used for math and English only. As I see those other requirements, I'm like, that's why everyone keeps putting in their AP psychology. It makes sense now. And those prerequisites need to be taken in the US and from accredited schools. We recommend, but don't require these 4. So if you're thinking, I need to plump up my GPA, I might want to take a few more things, these would be some good ones to look at. There's no it meets or doesn't meet because it's not required. So just do your best to find one of those if you want to give yourself a little advantage. If you are invited for an interview, we do about 120 interviews, and those are spread from August until March, so it's quite a long extended time period. There'll be a math test, an English composition, and then a medical terminology test. The first 2 count in your interview score as the faculty, evaluate your answers to questions. And then the medical terminology is just for your information. If you are accepted, then there'd be a drug test, background check, medical screening, those kind of things. So those are some of the features of that aspect. We do have some preferences. We give a slight preference for our own graduates, US citizens, legal permanent residents, but of course, students from other schools and from other countries apply and can be accepted as well. The prior healthcare experiences fit in with 1,000 hours that are required. We do have also, as Ketchum was mentioning, quite an interest in community service and giving back. And so people with experience giving back to underrepresented populations is great. And the healthcare, it doesn't have to be in healthcare. With volunteering and community service can be cleaning up a beach, helping animals, helping people in any way, shape, or form. Also, if you have any chance to go on an international missions health trip, then that's great. I know that's a trick right now. So maybe something to think about later. Not required, just a plus. And then shadowing is extremely important. Want to reiterate that. Not within your job. So sometimes people say, oh, but I am an ED tech, so I work with PAs all the time. We want you to focus when you don't have your own responsibilities and you're just thinking about how is this provider interacting with this patient and the rest of the healthcare team. So I encourage you, even if you have been immersed in that environment, to set aside some time to just focus on that. We will be requiring, I think, 20 hours of shadowing going forward. So definitely something you want to make sure is on there. Typically, our PA students are in that classroom 5 days a week, as has been mentioned, and absences are not an option because you just miss too much information to keep up with a fast pace. That first year is all the didactic instruction with quite a few hours in quite a few sciences and clinical medicine, pharmacology. These are some of the class titles. So we cover clinical medicine in all areas, genetics, there's global health, there's ethics and professionalism, all sorts of that material. And then the second year is the clinical rotations with 9 rotations. Several are required, you get 1 elective. And we have a lot of elective choices, and as a program, as we've been building up, we have more and more choices as time goes on. Now these are spread across Southern California. So from Topanga to Yucaipa, from Victorville to Temecula, kind of the whole shebang. So there's a bit of geographic spread on that. But as Ketchum had also mentioned, a lot of our students do find their first job through those experiences and those networks. So that is a good thing for them. Okay, financially, our program tuition total is about $106,000. That is spread evenly over the 2 years, the 6 semesters. Most of our students use federal student aid with the FAFSA, and we do have some partnerships with some area providers, but big caveat, you cannot work full-time in PA school, so don't even think about that. We had one student I know who made use of this, and I think that she probably worked for Kaiser, was one of our partners, and I think she probably was on call and picked up a shift once a month or something like that, if at all. So with our program, you have to get special permission to be employed, and if your academics suffer at all, then that is something that goes away quickly. So just know that this is your full-time job in PA school. So that is the official part, and I want to make sure we catch up here on time. So if you do have any questions, please feel free to put them in the Q&A as Christine has instructed you, and I'll be happy to help you out with those there. Thanks.
This was amazing. Awesome presentations. Thank you so much, all of you. If students have any questions, please feel free to put it in the Q&A. We do have 2 practicing PAs who joined us already, so I will start the professional panel in a minute. I wanted to ask the representatives, while you guys are all here, if you have any comments on, I have 2 things that students tend to stress out about recently. One is getting letters of recommendation. Because of COVID, we are online, so students are struggling. So did you have any comments on letters of recommendation, and also on any COVID-related changes that your school may have made in the application process? So since Stephanie, you're on my screen, would you like to start with that?
Sure, that can be difficult. I know it's made it so hard for so many of us in all different ways. As far as how it's changed our application process, we are doing our interviews virtually now. We do the testing in a monitored and time-limited way online. And we have group interviews with a small panel of faculty and a small group of students. So that has been a fairly seamless transition to moving those online, but I know that it can really be tricky with technology. As far as letters of recommendation go, you know, I saw there were a few freshmen here, so kudos to you guys for getting started. This won't last forever. We will come out of it. And then those of you who are juniors and sophomores, you haven't been in this forever. So go back to some of those relationships you might have built with the faculty that you did get to see face-to-face. Touch base with them, check in digitally, you know, how you doing? Just wanted to say hi. And then later when it's time to request those, you'll have that connection. These can also come from medical colleagues when you're getting your patient care experience. So it's not limited only to the academics, and it can also come from supervisors in jobs and people you volunteered from. So you have a few choices, and I know it's tricky. I feel for you guys.
All right, Jaziel.
Yeah, so we did not require any admissions tests, so we have no changes for COVID due to those admissions entrance exams, but we are accepting online labs, which we did not before. Pass credit will be accepted due to the pandemic for the year of 2020, so that would be counted as a B, and then pass credit will, for the prerequisites, will be counted as a C. So before we would not accept the pass credit, no pass credits. That's pretty much the only change. And then as Stephanie mentioned, virtual interviews. So definitely we encourage you to learn how to get on these Zoom platforms, have a professional background, still be professional when you were in your interview. As for letters of recommendation, building those relationships that you have with the professor. You know, I know it's hard right now, but through Zoom, if not, if you're doing some virtual shadowing, that could be another potential letter of recommendation, but just kind of doing your research and being creative in how to reach out to PAs right now, especially if you are newer to getting closer to the application.
Thank you. Chinadu?
Yeah, so my 2 cents is really similar to Stephanie's from Westerns and Jazziel's, or sorry, Stephanie's from CBU's and Jazziel's from Westerns. So in regards to letters of recommendation, typically we're looking at what's strongly recommended for LORs is at least 1 letter of recommendation from a clinician who you've known for at least 6 months, and 1 letter of recommendation from an academic professor. So where you can start for the LORs is just what you've done before the pandemic happened. So any professors or clinicians who you've worked with or who you've had a good relationship with before all of this went down, you can start there and see if you've had any good connections that you feel comfortable with there. But also, you know, we do understand that maybe you've had some virtual experiences in class or virtual lectures in your undergraduate experience. And you can feel free to reach out to your professors whom you've had those virtual class sessions with. And sometimes or many times, you know, they understand the situation and they'd be really willing to help. So that'd be a really good thing to kind of to approach. And I think that would be something that can help out. And in regards to the COVID situation, so for our program, just kind of similar to Western and CBU. So before the pandemic, we didn't accept online labs, but we are taking exceptions because of the current public health situation. So you can go ahead and feel free to take those online labs. For our program, you know, taking an online lab or taking an online lecture is completely fine, as long as it's from a regionally accredited institution. And then in regards to everything else with the COVID situation, you know, currently our students are taking most of their lectures online, but there is also some in-person activities that they do have to do for patient assessment skills and clinical skills and things of that nature. So although, you know, it's really a tough time, we are just trying to go with what we can do, following the leadership of our of MBKU and our presidents and our executive board, and just really taking it day by day. But of course, we're going to look forward to seeing what we can do to get back on campus as fast as possible so the students can enjoy their experience in PA school. So any other questions related to that, just feel free to email me.
Thank you so much. There is one question in the Q&A. I think I know the answer, but I'm gonna post it to you guys anyway. Is there a limit how many PA school students can apply to? My understanding is there is no limit.
No limit.
Okay, very good. But thank you so much for being here today, for sharing your information. I will be sending a follow-up email to students. So if you want me to share your presentation, email, any type of message, please make sure that you send it to me. And we're gonna move on to the professional panel. So we have 2 practicing PAs. So now it's the time to make those nice connections and ask all the questions from PAs who are working in the field. And welcome Lino and Carrie.
Hi.
If you guys can turn, hi Carrie, nice to see you.
Good to see you as well. Thanks for having me.
Thank you for doing this for 3 years in a row.
I know.
Lino is.
Hi, how are you?
Yeah, you're there. Okay, awesome. So always the opening question, please introduce yourselves. Tell us a little bit about your undergraduate background and where you work today. Carrie, you want to start?
Sure. So Lino and I were classmates actually at USC. I graduated in 2012, but prior to that, I was a grad or Pepperdine student, was there for sports medicine and nutrition. And then I worked for 2.5 years as a medical assistant at an orthopedic practice in Santa Monica before applying to PA school. I currently work at that same orthopedic practice. I've been there 8 years. Work mostly upper extremities, so everything from the clavicle down to the fingertip is pretty much what we see. Though we see a little bit of trauma and help out in other surgeries as well. Yeah.
Lino?
Hi, everyone. So like Carrie said, we're classmates from PA school prior. I went to UCLA. I studied psychobiology. After that, took a couple of years preparing my application for PA school, did some neurobiology research nearby where I was living. And then like Carrie, this is kind of a rare thing, but since graduating PA school, I've been at the same place as well. I work in the emergency department at LAC USC Medical Center. So it's been about 8 years as well.
Awesome. So next question I always get from students, how do we make sure that PA is the right fit for me? Any suggestions of how you did that discovery?
Well, for me, I think it's tough during COVID, but I would reach out to any professional that I knew of that was in any specialty that I might have considered. So I was interested in physical therapy, and one of my summers off from school, I worked as a PT aide at a clinic back home. I was a sports med and nutrition major. I thought I wanted to be a dietitian. And so another summer, I spent the summer working at West Hills Hospital in the Valley in their dietetics department. And then I actually learned of the PA profession from an adjunct lab professor who was a PA in neurosurgery, and it felt like the right fit for me. I had a lot of experience with dentistry. My dad's a dentist, and knew that wasn't for me. But I think it's more so just ruling out what isn't for you by trying it, getting exposed to it, and really like meeting people of different industries to see what fits for you, lifestyle wise, interest wise, etc.
I totally agree with what she's saying. I think some people know outright that this is the direction that I'm going because of previous background. Maybe family members have certain professions that draw them to that career. But those that are kind of in between and are open to exploring different options. For me, the decision was really made after I had actual experience with physician assistants, because the field is still pretty new. A lot of people still don't know about physician assistants. So, shadowing physician assistants in the emergency department really gave me an eye-opening kind of understanding firsthand what they do, how they approach patient care, how they, perform the standard of care for patients, just like, the physicians do, and, nurse practitioners. So it's really, it was a good experience for me to understand like team dynamics. It's not just one provider, but working collaboratively with a supervising physician was something that I desired. And that's not something that's for everyone, but it did fit my personality and what I wanted to get out of the profession. So.
Anybody has any questions? Or I should keep going, because I can. All right. Oh, one question in the Q&A. Awesome. How it's like to work as a PA, pros and cons. That would have been my next question. So thank you for asking. And we have a baby on board. Hi.
Yes, I can start. So as far as, I think it really differs on what kind of setting you work in. In the emergency department, it can really vary. I work at an academic institution. So in a 12-hour shift, we work with 2, sometimes 3 different attendings. So really being flexible is important. Really being able to have like a very collaborative approach to patient care and showing respect towards one another is really important as well. I think that aspect can be difficult, but it can also be something that is beneficial because you're getting a lot of support you know, 2-3 minds are better than one sometimes, especially when you have a difficult case. We get a lot of complex patients at the county hospital with uninsured patients that other hospitals may not see. And we have such a broad base of medicine that we have to cover, anywhere from like, you know, primary care like situations all the way to life-saving kind of measures. So, you know, having this team approach and working with different, you know, physicians, residents, nurse practitioners is only beneficial, I think. And there's many specialties that, you know, can, you know, help you make decisions into appropriate patient care. So that's kind of my experience with working in a broad institution with a lot of different providers and staff.
Carrie?
Yeah, I agree with that as well. I think I work mostly, I'd probably say 80% of the time with one physician, but you know, there are 13 physicians in the practice that will need surgery help or work in a different joint or different subspecialty. And so we can consult them and work with them, and there's fluidity within our practice, but also the ability to change specialties is really nice too. Like if I decide tomorrow that surgery is just too hectic and too time consuming for that, and you know, my family, then I can change paths and work at a student health center or work, you know, in family medicine or another clinic and dermatology. And so for me, it was less pressure to know for certain what specialty I wanted to do for the rest of my life. When I graduated PA school, I appreciated the ability to change. And like Lena said, it is odd that both of us are doing the same job we started when we first graduated from school, but a lot of our classmates have jumped specialties. They're in dermatology and family medicine and picking up urgent care shifts here and there. And it kind of helps with burnout too, if you're able to do a little bit of everything as opposed to seeing the same thing all day long. I guess one of the cons though is that people still, at least on the West Coast, sometimes have trouble understanding what a PA is, what a PA does. So it's getting a lot better since I've been working, but there still is some confusion about what we can do and can't do. And I think the name physician assistant is a little bit of a misnomer. And so some of our older patients just have some doubts going in, but you prove them wrong with your knowledge and your trust, and it makes it easier for their future visits.
Awesome. So questions are coming in. So have you done any undergraduate research?
I did. At Pepperdine, I did research in within the sports medicine department. It was like a biomechanics lab. It's so long ago, I can't really remember the exact projects that we worked on, but I did have some research, not a ton. Lena did too.
I did like animal study neurobiology research where we looked at chemoattractants and how they manipulate cell migration at kind of like a neural crust level. So we did like dissections, different like cell tracking, very like different aspect of, you know, science and healthcare, but definitely like important and necessary. So I think it gave me a good appreciation of like, you know, this is like what science does for something like medicine and healthcare and things like that.
The next question, I think Carrie addressed already, but I'm going to pose it anyway. Have you ever switched between departments, professions? If so, how did you adapt to the different specialties?
So I haven't, and Lino hasn't, but there's most of the training that people do if they change specialties is kind of on the job training. That's one of the other beauties about a lot of the PA programs here is that they're focused on family medicine. So you get a really strong base, a really strong general knowledge that you can then learn the nuances of each subspecialty, but having a strong foundation about health in general and how the body works and how different treatments for things like diabetes and hypertension, et cetera, work, it makes a huge difference with being able to change subspecialties. I would probably have a much more difficult time changing my profession than Lino would, because Lino sees a lot of the general health complaints every day, we still have to consider like heart disease, diabetes, hypertension, et cetera, when we're working with our patients with regards to the medications we prescribe and with the surgeries we perform. But my depth of knowledge these days is not nearly as extensive as Lena's is, I'm sure.
I just want to add that if, when I was considering a specialty during my emergency medicine, like early on, I had thoughts of going into orthopedics, but I think you have to kind of make a decision on, is a specialty right for me? Because once you become a specialist, is it difficult to go back to something more broad, or as far as like your work, but also like in your knowledge base, like Carrie was mentioning. So I, explored that option, but in my mindset, I do love the variety of my work. I do love the, really expanded knowledge of all the, disease processes that I have to be responsible for and to recognize. So, I may consider a specialty later on, but right now I'm still enjoying emergency medicine and, the diversity in it, and it's challenging still. So, but it's definitely something that I think all of us kind of think about, especially when we are in a profession that has the ability to be flexible. But, also it's really up to you to decide whether like your knowledge base, you can be a specialist and be really good at, this thing, but then, or you can be that broad practitioner that, can be good at a lot of things, but maybe not as like a specialist does for one thing.
Thank you. So there are two questions, one in the chat, one in the Q&A, that are very similar. So what's your advice for pre-PAs who are searching for shadowing or volunteer experience in medical facilities during a pandemic? So I combined the two questions into one.
Yeah, that's really hard right now because we're limiting visitors. We're limiting the number of patients we can see right now. Patients aren't allowed to bring anybody else into clinic with them unless they're a minor or need assistance. So it's just tough. We unfortunately can't have student shadows right now. I guess the best thing you could do is to try and reach out to a PA or practitioner that you're even considering, for your own special or your own career one day. And just see if you can either do a Zoom call like this with them to ask them questions, or to, email with them and ask them questions. It's not the experience that you want, but it's better than nothing. And it's just really difficult in a pandemic. Just because everyone's sick and resources are stretched thin. And providers also are just like so much more is being asked of them right now. So it's kind of a tough time to add on shadowing. But that said, we all understand where you guys are and that you're trying your hardest to get that experience to get into school too. So have your thoughts, your questions well thought out before you reach out to them, and make the most of the time you can.
Yeah, shadowing experience is limited, obviously, but really, I think looking at institutions, some still do use volunteers. So, sometimes you can look into a volunteer program that has certain requirements. Obviously, you have to have a time commitment. Sometimes they're up to a year. In the pandemic, it may be limited with, picking up shifts, but it may still be available to you where you can, find a program that has some, shadowing with PAs. It may not be all the time, but it could be like, in an adult ER setting where PAs happen to work, and, you may have some exposure like that. Sometimes institutions does have red tape, meaning like you have to have a lot of like HIPAA compliance. There's administrator things you have to get through. So if you have like an outlet of like a volunteer program that can kind of cut through that, and with your commitment, that could be a good option for you. The pandemic is really limiting everything right now, but I do still see some volunteers at our institution. Also, some of the smaller clinics, you can always reach out. Sometimes they can make exceptions if it's like a limited time or one day. Like Carrie mentioned, I think during this pre-PA process, it is important to have some guidance, whether it's from an academic perspective or a professional perspective or both. just so that they can be your mentor. They can give you suggestions. They can look at your application. They can give you pointers and things like that. So just, keep your options open. You may have to kind of, like Carrie said, do Zoom calls, or you may have to, get in touch with maybe a clinic that can have you in on teleconferencing, like telemedicine and stuff. You just got to be flexible. You just have to be proactive and reach out. You might get a ton of no's, but someone might actually say yes, and it might be to your benefit. So I wouldn't give up, and I would keep trying.
Thank you for that. Just to put the Career Center's 2 cents in, we do, for students who are looking for clinical experience, we lately recommend trying to find paid positions, such as medical assistant, scribing, and because when it's paid, then they need you. So volunteering did decrease for sure because of the pandemic, but medical facilities still need employees, and then they train you, they make sure you have all the necessary equipment to avoid getting infected. So that's another opportunity for you to consider. Okay, I'm not gonna go in order because one of the questions that is first now, it's usually my last. So I'm just gonna ask the next one. Do you ever take work home?
Yes, I think everyone's working from home a little bit these days, but yes, that is, I think, a fault of mine, but it's also just again, like I said, the volume is so much right now that everyone wants to be seen, but we're limiting the number of patients that can actually be seen in the office. So you're trying to be as efficient as you can with your in-office hours, that I, as a result, tend to take home work probably more than I should. I think my hours are probably about 50, 55 hours a week, Monday through Friday, including probably the admin time, but there's always more stuff to be done. I'll let Lino answer, but I think his situation would be a little bit different given that he is in an ER.
Yeah, so I do shift work where, it's not like, I think in Carrie's situation, like, her practice has a specific amount of providers, and they're responsible for a certain amount of things. And so if one has to be off or whatever, it may affect the rest of the practice. When you're working in a big institution like an emergency department, and especially LAC USC, we have more than 20, nurse practitioners and PAs. We have another like 20 plus residents in each class. And then we have attendings as well. So shift work does have some benefits about taking work home. I do not take work home. Some rare occasions I may stay over my 12-hour shift and finish up some charting, or I'm in the middle of doing a procedure that I need to finish before I go home. But most of the time, it's 12 hours, and if you're not done, you pass it on to the next provider. You may look into what happened to that patient the next day out of your personal interests, but it's pretty rare to take work home. But just, I think it's institution based. I have a peer of mine that's also a PA that graduated from USC. She works at a different emergency department, but she's constantly like backed up with charting. So she does take work home and has to finish charting, on her off time or during admin time. So it really just depends on the place that you're working in, the amount of providers you have for your patients, the volume of patients that come in. So it just varies case by case.
Okay, next question. Are there other potential career options besides switching specialty?
I mean, once you're a PA, there's always the option to go back into academics, like to teach at like PA schools. Some PAs go on like Karen Bass and go into politics. There's all sorts of avenues. You can be consultants. I think there's one alumni from USC who works for pharma and does like research with their cancer patients on their cancer drugs. So she's kind of the clinician on site to check people's responses to the medication that they're treating. There's always military options too. So there are a ton of options. I know a PA who works in the FBI as well. And so he's on site when they call the SWAT and FBI out, and he's like there to help treat and triage and He also helps do like Medicare and Medi-Cal or Medicare fraud. So yeah, there's a lot of different avenues to go outside of the ordinary box of being a clinician seeing patients.
Yeah, I think the opportunities are pretty wide and very varied depending on what your interest is. You know, I know forensic PAs. I know people who serve as medical expert witnesses for malpractice cases that make their own hours, make their own, you know, charging fees. Sorry. And then a lot of times, you know, you can go into academics, which is probably the more common venue to expand kind of your PA role. You know, I do some clinical teaching at USC, and that just gives me an opportunity to kind of go back to basics, interact with the new class that's coming in, or, you know, the new professionals that are going to be out in the community and people that I may work with. And, you know, we just had a new hire from our PA program that just started with us. So it's good to kind of reconnect. But I would say academics is probably the most common, where you can go lecture, you can help with workshops, you can help with clinical skills like teaching and whatnot. So there's a lot of venues. You can get different certifications as a PA, not necessarily specific to PAs, but, you know, on the side, you can do things like tattoo removals. You can get trained to be like a laser technician specialist. You can even become an ultrasonographer if that's something that you're interested in, getting certifications and whatnot. So there's a lot of venues that you can look into depending on your interests.
Thank you so much. And the final question that I usually ask last, and I'm very glad Noreen posted it. What is one thing you wish you knew before PA school?
I'm gonna have to think about this one.
I can say something. I think the biggest worry about PA school is like, we have this kind of concern that, am I good enough? You know, am I gonna be, you know, a competent provider? And I think you shouldn't worry about that, because if you get in, you know, there are qualities about you that made you get to this step, you know, and you are qualified. And I think you have to get used to kind of that feeling of, you know, and being okay with, I don't know everything, right? And, you know, medicine is always dynamic and changing. I think all you have to do is have a mindset of making the effort to stay on top of your medical education, but also, you know, balancing that with your work life, your student life, you know, all that stuff. So be comfortable with having like that uncomfortable feeling about, you know, am I going to be a good provider? But I think that's really just to motivate you to kind of strive to, you know, do more for your patients, do more for yourself, so that when you do, you know, give that patient some information about, you know, their medical condition or their management, that you have that medical expertise and knowledge to be competent and also provide like good quality, like bedside care for these patients. Because, you know, they're coming to you in a time of need, they're very vulnerable, and it's really up to you to kind of build that kind of dynamic rapport that they're going to have some compliance for you and have good satisfaction about being a patient with you as well. So you guys will all do well. You know, just work hard, you know, get in, you know, follow the steps. All the programs are well accredited. They all have good matriculation, and they're all, you know, very, very like well prepared for the students and to make them professional PAs as well. So
Yeah, I think I echo those sentiments, but also, you know, PA school is expensive. Like, it takes a while to pay off those loans if you have loans, and just make sure it's really something you feel passionate about. And it breaks my heart when you hear people like going into these professional careers and then 3-4 years later have decided, nah, it's not for me anymore, and then looking for the next thing to kind of become your career. So as much as you like, really think about it. And if you don't get in, think about it again. And it doesn't mean that you weren't the best candidate. It just means that maybe the timing wasn't right or the numbers weren't right. But it gives you more of an opportunity to keep exploring and keep, you know, soul searching, seeing if it's right for you, and making it happen. We've got many MAs in our practice that have applied 2 years in a row, and they're all fabulous. Any one of them I would highly recommend, and I have recommended them, but it's not their time. So I think that they're learning more and more that this is something they want to do because they've experienced it and had more opportunity. But just don't get discouraged, but really think about it, really make sure that this is something that works for you.
Thank you so much. Thanks everybody for joining us today, for taking time away from your families, from your other responsibilities to be here with us. I truly appreciate it. And I'm sure the students got a lot out of it. So again, thank you so much. And if there is anything that you would like to share with students, you can always email me, because I will send a follow-up email to all our registered students, which were 83 in the system. So please let me know if there is anything you wish me to forward to them. And thank you. Have a wonderful evening and see you next year, maybe. Thank you so much.
Thank you. Thank you.
Bye.
Bye.